I would now like to call upon Madam Lakshmi Puri to kindly come and give a keynote address on inclusion in the urban context and set the tone for the event. Though Ms. Lakshmi Puri needs no introduction, we would like to highlight her contribution toward gender equality and women empowerment. Madam Puri has been a former IFS officer and ambassador and has been actively engaged in multilateral diplomacy since 1981. She has served as UN for 15 years, where she has contributed to trade and economic policy as the director of the International Trade Division at the UN Conference on Trade and Development. She was also appointed as Assistant Secretary General of United Nations and the founding Deputy Executive Director of UN Women. She has been the recipient of Eleanor Roosevelt Award for Human Rights in 2016. She has been instrumental in ensuring the adoption of gender equality and women's empowerment goal under the Sustainable Development Goal. Thank you. Over to Mrs. Puri.
Good morning. Namaskar. I'm honored to be here today to be at this National Conclave on gender and disability inclusion in India's cities. And this is the tri-junction of the three policy areas of what I should say, human rights, of sustainable development, which I'm very deeply committed to. So I'm particularly pleased to be here for that. Distinguished delegates from the British High Commission and the United Nations, officials from cities, NGOs, and my dear friends, and especially I would like to recognize Dipendra Manocha from Saksham and Nidhi Goel from Rising Flame. I would also like to thank the National Institute of Urban Affairs, Mr. Hitesh Vaidya and Shantanu Mitra, Head Infrastructure and Urban Development, British High Commission, and Mr. Shombi Sharp, United Nations Resident Coordinator, for their leadership and championing the goal of an inclusive and universally accessible India by 2047. Also, many thanks to both the ministries of Housing and Urban Affairs and the Ministry of Social Justice and Empowerment, as well as the NIUA for their tireless work in implementing the new urban agenda. And I had the privilege of shaping that agenda when I was with UN Women. We were actively engaged with Habitat and at every regional and global forum leading up to the Quito Declaration and the adoption of the new urban agenda. So, and it really, at the heart of that is the philosophy of leaving no one behind, what we in India thought about even much, much earlier, and which has been adopted by Prime Minister Modi as a crucial, as the core of his Sabka Vikas, Sabka Saath, and Sabka Vishwas and Sabka Prayas. And that is Sarvodaya and Antvodaya. So that is the spirit of leaving no one behind. I would like to compliment NIUA for organizing this conclave, mainstreaming gender and disability inclusion to strengthen the knowledge base and capabilities, as was explained by Mr. Mehta, inclusion to strengthen the knowledge base and capacities of city officials and urban practitioners with guidelines, digital toolkits, and best practices and smart solutions. There are currently, as you know, More than 1 billion disabled globally, and 20% of them live with great functional difficulties in their day-to-day lives. So some have referred to them as the invisible majority. Almost 80% of persons with disabilities live in developing countries. And in the years ahead, disability will be even more significant concern because its prevalence is rising due to due to aging populations and the global increase in chronic health conditions such as diabetes, cancer, pandemics, after effects. Now, after these 2 years of COVID, we are seeing even a greater rise in all of these issues globally. And then when we look at the gender dimension of disability, the numbers of disabled women are higher globally than those of disabled men. And this is due to neglect in healthcare, poor workforce conditions, gender-based violence, and the intersectionality of discrimination that women and girls face. So women with disabilities are more vulnerable than disabled men because of gender pay gaps, violence, attitudes, and customs, and other forms of discrimination and harassment. Therefore, women with disabilities are doubly disadvantaged, multiply disadvantaged, I should say, experiencing exclusion based on their gender and disability. So in India, on the other hand, it seems, and I was quite surprised to see these statistics, 21% of the total population is disabled. Out of these, 56% are males and 44% are females. It is concerning still because, as per the census of India, the percentage of persons with disabilities in the total population has increased from 2.2% to 2.24% in 2011 in rural areas, whereas it has risen from 1.93% to 2.17% in urban areas. So an increase in urban areas, which is significant during the same period. Not only this, only 55% of the disabled population of India are literate, compared to 74% of total literate population. So hence, people with disabilities have poorer health outcomes, lower education achievements, less economic participation, higher poverty rates than people without disabilities. And this is because people with disabilities experience barriers in accessing services that many of us have long taken for granted, including health, education, employment, transport, and very important, and information, mobility, and hence to achieve long-lasting and vastly better development prospects and sustainable prospects. Inclusivity is a very important part of sustainability. We must empower people living with disabilities to remove the barriers which prevent them from participating in their communities, getting quality education, finding decent work, and having their voices heard, and being in positions of leadership. At Habitat 3, when I had the privilege of advocating for gender-responsive new urban agenda, we ensured that the Quito Declaration envisioned the goal, and I want to quote, to achieve gender equality and empower all women and girls, ensuring women's full and effective, inclusive participation and equal rights in all fields and leadership at all levels of decision-making, by ensuring decent work and equal pay for equal work, or work of equal value for all women, and preventing and eliminating all forms of discrimination, including those based, of course, on disability, violence and harassment against women and girls in private and public spaces. And this is a very important issue about private and public spaces, because that's where in public spaces, that's where the urban development accessibility angle and participation angle comes in. Now, the SDGs also have, as you know, emphasized the inclusion of vulnerable populations in all 17 goals. The unique aspect of the new urban agenda of the United Nations stimulated the implementation of global agreements at the local level by promoting urban policies, services, infrastructure, and products. So at the national level, as has been mentioned, and I will not go through all of those details, but you have adopted the harmonized guidelines and space standards for barrier-free built environment for persons with disabilities and elderly persons by the Ministry of Housing and Urban Affairs. And this is a very important, shall I say, pole star to guide the different state government, central government, but also, and this is what I want to emphasize, all stakeholders, private sector, because in the whole process of urbanization, the space of the private sector, the space of the civil society is far bigger than what we would call, the public sector space. So we need to have the inclusion of all the stakeholders in of course, sensitizing and implementing these guidelines and owning these guidelines. I think it's really important to do that. And then, of course, a number of also what has happened is not only to normalize creating and retrofitting built environment in urban areas across India, but they have been notified of the standards for accessibility with Right of Persons with Disabilities Act 2017 by making non-compliance with the Act punishable by imprisonment. So this is some, this ensures enforcement and the power of, the law. Accessible India campaign is a nationwide flagship campaign to achieve universal access and enablement for persons with disabilities through infrastructure ecosystem. So this is advocacy, movement building, draft national policy for empowerment of women to address gender inequality and strengthen institutional mechanisms. So they work, so gender policy and disabled empowerment policies must work together, and institutionally as well as in terms of advocacy. And then you have the national mental health policy. And, sometimes I feel that when we are counting, how many women are disabled, we are not enough capturing the data on women suffering from mental health issues. So, we have to look at also in terms of data gathering as we go forward. National mental health policy, which prevents mental illness and promotes destigmatization and response. National policy for elderly, other urban policies and programs, including Smart Cities Mission, PMAY, Urban, Amrut, also enforces accessible and inclusive practices in the development process. And one of the examples from the Smart Cities initiatives is implementing placemaking and ICT-enabled infrastructure and the development of sensory parks, all abilities parks to tackle barriers and challenges faced by persons with disabilities. And then there are some very good examples. Chennai Smart City successfully developed 2 inclusive parks for people with special needs and has sensory equipment with exclusive play features. Even though our policies and programs streamline the intent, and this is very important, intent to make the city infrastructure inclusive, accessible, and safe, gender and disability inclusion are 2 significant challenges our cities face. And this conference is the occasion to bring the discussion of this intersection into to ensure that substantial investments are made to develop the capacities required to ensure that we don't leave anyone behind, and every woman and every girl counts, particularly those that are disabled, and that they are visible in decision making. Further, it is about building a strong engagement and consultation network of NGOs and CSOs to have extensive awareness and sensitization programs for beneficiaries and stakeholders, whilst also providing avenues for people with disabilities at all levels to hold decision makers answerable for their actions or inactions and seek redress when necessary. And of course, you can have a wonderful policy, but if the state governments and the local governments are not implementing it, then it doesn't get feet, it doesn't get arms, and it doesn't move. So we need to make sure that state governments and local governments develop comprehensive policies and guidelines to have beneficiary-specific policies, budgetary provisions, and entitlement provisions for people with disabilities. Because, I think this entitlement provision is a very important component. It's about their human rights. So, and to disability to ensure effective adoption and implementation. Our challenge is about changing mindsets, movement building, bringing into the conversation all stakeholders, ensuring they understand that the idea of universality, non-discrimination, and inclusion is as much a societal as an urban development issue. It is also about ensuring actual implementation by state and local government authorities and developing monitoring systems to review the actual impact and benefit for women and girls with disabilities. So our cities, and this is what you're trying to do through this conclave, that you are making a repository of innovative solutions and good practices, because nothing like actual experience and good practices, what has worked, what has not worked, to drive the actual implementation and effective implementation going forward, and also to develop an ecosystem that supports innovative technological solutions. And I think technology is a major, shall I say, enabler, and which will enable us to leapfrog into a different state of inclusion for the disabled, and of course, disabled women and girls as well. The Internet of Things, real-time connectivity, ensuring access for people with disabilities and the elderly. So I would like to also mention that policy framework is needed, of course, at the national level. It's already there, and it's a wonderful policy. I think it is a role model in so many ways, but we need to have the 3 A's in place to give it life. One is attitude. There's 2, accessibility and affordability. The 3 things, how can we drive that forward? So I have just very, very brief suggestions for that, because unless we prioritize accessibility and inclusivity, and we don't, and take action on these lines, we don't transfer what we are intending, the intent, to the ground zero, to the actual people who are affected by disability and who need to be supported and enabled and empowered. Absence of, so what are the kind of the setbacks that are there, or the deficits that are there? One is the absence of a monitoring system at the state or district level in many cases, absence of advisory boards on disability and district or city level committees that can monitor and evaluate the impact. Absence of an integrated ecosystem, the silo mentality crops up and different government departments fail to communicate their initiatives and programs with other ministries and departments. And therefore, minimum convergence of policy is often noticed, and need for a state advisory board, perhaps, like the Kerala government has, and a district level committees that identify and list all relevant stakeholders and activities. So, solutions. Attitude, as we already said, sensitizing and educating the masses. I think everybody needs to be sensitized as much as the beneficiaries and the program, those who deliver the programs and implement it, but also promoting cultural, educational, positive aspects of cultural, educational, and aesthetic aspects of disability-related empowerment. Then considering the 74th Amendment Act, the 12th Schedule, etc., it obligates the urban local bodies to safeguard the interests of weaker sections of society, including disabled. So this act needs to be, the sensitization has to begin even at all corporation schools, for example. Unless we are able at that level to provide educational opportunities to disabled children, we are not going to grow towards an inclusive society, economy. Accessibility, and it's about also physical and web-based infrastructure. Developing an integrated and holistic ecosystem where relevant stakeholders can come together to create accessible, safe, and inclusive cities for persons with disabilities. The state must create a district advisory body and local level committee, as we said, identifying stakeholders and activities with allocated timelines to achieve specific sector-based tasks for inclusive cities, for example, mandating mobility audits. Also, there's an opportunities for cities to have a public and private partnership to expand, as I said, the multi-stakeholder approach to expand web-based infrastructure and software-based innovative solutions for people with specific disabilities such as hearing, visual impairment, etc. Affordability, having an affordable public infrastructure is the key component here, and everyone should have equal access to the resources, infrastructure, and support system, irrespective of the income group. And there should be state, center government incentivizing local bodies to create accessible, safer, and inclusive cities. So let me conclude by calling on all stakeholders, governments, innovators, NGOs, and training institutes to strengthen this kind of inclusion, because it is a major force multiplier. If you can, for inclusion and sustainable development. Last, I would like to once again congratulate the efforts of the National Institute of Urban Affairs in coalescing the actions of the United Nations and the Foreign Commonwealth and Development Office of the United Kingdom government to mainstream the need for an inclusive urban future for all. Thank you.